You could divide the different types of food allergy up into the food type of allergy, which is generally split into immediate type allergy or delayed type allergy. The immediate type allergy is sometimes called IgE, antibody mediated allergy, and the delayed type is called non-IgE mediated allergy. The delayed type allergy often takes a couple of hours or more before it starts to manifest after ingestion of the food, whereas the immediate type allergy takes is almost within minutes, almost instantaneous, and occasionally can be a little bit more delayed up to a couple of hours later. But it's more important that the foods, and we know that there are what we call the most common foods that cause food allergy in children, and those are generally milk, egg, soya, and wheat, as well as fish and tree nuts and sesame. Those are the big sort of six. We usually lump sesame and nuts together, and those are the most common causes of food allergy in children. So we have tests are mainly a measurement of the IgE. So for the delayed type of allergies, there's no test. It just depends on your clinical decision based on the parents' description of their child's symptoms. For the immediate type allergy, you can confirm the diagnosis by using a test for IgE antibody, and that can be a blood test, or it can also be a skin prick test. And a skin prick test is where the allergen or a solution containing the allergen is dripped onto the skin. A sharp implement is used just to prick through the surface into the top layer of the skin. The drip is wiped away and then left for around 10 minutes. And the positive will come up with a wheal or a bump on the skin, which can be measured and decided whether that would support or not the diagnosis of immediate type allergy. When you have slightly more complex allergy, you can also look at the individual proteins present in some of the foods. And these are called component tests, as they look at the individual component proteins making up those foods. These can be important for children who may be outgrowing that allergy, as it can tell us whether or not they're likely to suffer from a more significant reaction or a milder reaction, which wouldn't need so much treatment. So, the complications of food allergy are in the sense that once you have one allergy, you are more likely to have another allergy than someone who has no allergies. So once you have one, then you can increase the number of food allergies that you have. So that's one of the complications of it. And that's why, particularly when we diagnose food allergy early, we try and get the other foods introduced to try and reduce the risk of developing those allergies later on. The risks associated with them are reactions, and reactions are alarming, particularly for the immediate type allergies, as you can often see the reaction developing in front of your eyes. You'll see a rash occurring, what's called urticaria, which is a hive-like or nettle-like rash that can occur all over the body. And sometimes you can get some swelling of the lips or around the eyes, or sometimes the ears or other parts of the body too. And this is quite alarming as well. It's much rarer to get what's called anaphylaxis, which is well recognized in the media and press, where reports are often newsworthy, and that's because they are rare. But those are generally causing respiratory difficulties, cough or wheeze, or cardiovascular difficulties with blood pressure. And those are much more serious and rare complications of allergy. For the children with non-immediate allergy, they get a delayed type symptoms, and that can be quite difficult for them to manage, as they'll often have persistent abdominal pain when they have taken their food, and that may last for several days afterwards, whereas the immediate allergies do tend to get better quite quickly as well. They can look for those signs. I think it's really important that they're educated in what signs to look for the hives, to look for the swelling, and also to look for the signs of the more serious reactions. I think it's important that they have an allergy action plan, a plan to follow if they have a reaction or they're suspicious of a reaction. And this would involve some treatment measures such as an antihistamine that they can provide to the child, or an adrenaline injector pen if the reaction is thought to be serious. And the education is crucial for explaining to parents which treatment would be the appropriate in which scenario. Those are probably the most important things for parents to be aware of. But also it's prevention, and prevention means that parents need to be have as a routine, need to read the labeling of their food packaging to make sure it doesn't contain in the ingredients any of the foods to which their child is allergic. Yeah, so a real worry for parents is that they are not able to provide appropriate nutrition because of their food allergies, particularly in those children who have multiple food allergies, and particularly to those foods which are staple to our diet, like wheat, egg, and milk. I think the most important thing is to get some nutritional advice, and I'm always keen to provide that or direct parents to an appropriate dietitian or nutritionist to get that advice. Realistically, the biggest problem is perhaps with milk, and certainly in the under ones, and that group are the ones that are most susceptible to having a difficulty getting the right amount of calcium in. Other problems can be with children who have multiple food allergies, who may sometimes struggle with protein sources, but it's unusual for them to have a problem which can't be addressed with the appropriate dietary advice. So I always try and reassure parents that there is little problem in terms of nutrition in the longer term. Some children with milk allergy, for example, or early onset wheat allergy can have poor growth early on, but that's usually caught up once the allergen's been identified and avoidance has been instigated.